European and US leaders are rubbing their hands with anticipation for the largest free trade deal between them to come into force. But in Britain, it's got people fearing for their future of their universal state healthcare and that it could get exploited for profit by corporate America. Our London correspondent Polly Boyko explains.
British politicians have hailed it as the dawn of a new era. A huge transatlantic free trade deal that will make it easier to do business across the EU and the US. At the moment, it's being negotiated behind closed doors, but as details have emerged, public hostility has grown. Brits are worried about the agreement's impact on their cherished public health service. The aim of the Transatlantic Trade and Investment Partnership, or TTIP for short, is to create the world's largest single market between the EU and the US. As part of the agreement, public services like the NHS would be opened up to private, profit-making companies. Multinationals would be able to bid for UK state contracts. Campaigners fear that this will allow American healthcare companies to run UK hospitals, and that there will be more emphasis on profits for big business rather than patient care.
This will open the floodgates for private healthcare providers that have made dizzying levels of profits from healthcare in the United States. With the help of the Conservative government and soon the EU, these companies will soon be let loose, free to do the same in Britain.
The deal could put restrictions on the ability of the UK government to control the cost of medicines or to regulate the quality of the multinationals providing medical care. One clause is even more ominous. If the British government decides it doesn't like the services provided by a private company, cancelling the contract could be hard. That's because corporations will be able to sue governments for making decisions that could affect their future profits. No wonder an increasing number of campaigners want to see the NHS taken off the negotiating table. However, despite earlier assurances that it wouldn't be affected, the UK's Trade Minister has confirmed that the NHS will be part of the TTIP deal.
The UK's Trade Minister says that those against the transatlantic deal probably just don't like America. But the prospect of yet more changes for a health service already beleaguered by funding cuts, waiting lists and care scandals is making the public nervous. Just this week, a leading medical charity judged that the UK's cancer services have been so weakened by slashed budgets that hospitals can't cope with the growing number of patients coming to them with the disease.
According to a recent poll, 42% of British people don't trust the current government to protect the NHS from privatisation, while 39% think that the controversial trade deal would be bad for Britain.
What we're really seeing is a heist on the NHS budget. £100 billion a year is spent on our healthcare, and the consistent reorganisation of the NHS over the last 30 years has really been all about raiding that money. So the service is going to get more expensive and it's going to work less well. This is really not a good way forward, and the trade agreements will force that on us.
David Cameron said that the potential deal with Washington presents a once-in-a-lifetime opportunity. But that's exactly what supporters of the UK's National Health Service are worried about. That once services are lost to the private sector, they're lost for good. Polly Boyko, RT, London.